Matrix multiple response, matrix grid, next generation Nclex-RN question types, stroke, medical surgical nursing. Nurses notes, emergency department. 0730, the client, a 62-year-old male, was brought to the emergency department after being found unresponsive at home by his spouse. The spouse reports that the client complained of a severe headache and nausea 2 hours prior to collapsing. There is no history of trauma or seizure activity. The client has a medical history of hypertension and hyperlipidemia but is non-compliant with medications. On examination, the client is drowsy and responds only to painful stimuli. He has unequal pupils, right pupil 5 mm, left pupil 3 mm, that are sluggish to react. Muscle strength is 3-5 on the right side and 5-5 on the left. The client exhibits facial drooping on the right side. Vital signs. Temperature, 99.0 degrees Fahrenheit. Pulse, 50 BPM. Respiratory rate, 12 breaths min. Blood pressure, 200-110 millimeters of mercury. Diagnostic tests ordered. Non-contrast CT of the head. Blood glucose. CBC, BMP, and coagulation studies. Each row represents a clinical finding, and each column represents a possible answer. Select which findings apply to each condition by clicking checkboxes in the appropriate cells. Correct answer, hemorrhagic stroke. The client's presentation strongly suggests a hemorrhagic stroke due to intracranial bleeding. Key findings supporting hemorrhagic stroke. 1 sudden severe headache, often described as a thunderclap. Headache, a hallmark of intracranial hemorrhage. 2 unequal pupils, indicates increased intracranial pressure and brain herniation risk. 3 facial drooping and muscle weakness, signs of neurological deficit, which occur in both ischemic and hemorrhagic strokes but are more severe in hemorrhagic stroke. For loss of consciousness, common in hemorrhagic strokes due to increased pressure and mass effect. 5 hypertension, major risk factor for intracranial bleeding due to vascular fragility.